Good afternoon, and thank you very much for joining me. I'm very excited to introduce to you a brand new program from Special Olympics UAE called the Unified Healthcare Providers Training. This training aims to create compassionate and evidence-based healthcare. First, I'd like to introduce you to the Unified Healthcare Providers Training Team. My name is Khawla Barley. I'm the head of initiatives at Special Olympics UAE. Joining me today is Nipa Bhutani, the founder and director of the Applied and Behavioral Training Institute. Not with us today is my colleague Irene Abu Helij, who is the health programs supervisor at Special Olympics UAE. This training program is made possible through a partnership between Special Olympics UAE and the Applied and Behavioral Training Institute. Special Olympics UAE, as many of you may know, is part of the Special Olympics International Organization, and at its heart is a sports organization that provides year-round training, sports training, and athletic competitions for people of determination with intellectual and developmental disabilities. Not as well known is our work outside of sports, which spans across our Unified Champion Schools program, inside schools across the UAE, family support, youth leadership, other community initiatives, and our vast health programs. Special Olympics UAE strives to provide high-quality training for our athletes, our coaches, teachers, families, community members, and for the Unified Healthcare Providers Training Program, we have partnered with the Applied and Behavioral Training Institute, who has worked in the UAE since 2013 to provide evidence-based services for children with developmental disabilities. And in addition to their work in early intervention, ABTI leads and supports numerous community awareness and action programs across the UAE. We feel that the partnership between Special Olympics and the specialist training provisions of Applied Behavioral Training Institute have really helped us to develop a unique and impactful program. Now, the Unified Healthcare Providers Program has been born out of a need from the community, needs that have been expressed repeatedly by families of our athletes, as well as healthcare providers and healthcare providers that work within the Special Olympics health programs. Healthcare visits can be really challenging for people with intellectual and developmental disabilities, for their caregivers, as well as for the healthcare providers treating them. This training will introduce healthcare workers to scientific methods and evidence-based tools in order to support the behavioral and communication challenges of their patients. Thank you, Nipa. Now, I believe that this matrix, this table, will help clarify exactly how we implement the training and the principles that Nipa has outlined for us today. The Unified Healthcare Training Program not only delivers training to doctors, but across a variety of medical and non-medical patient-facing staff. So doctors, nurses, technicians, such as therapists, physical therapists, occupational therapists, lab technicians, x-ray technicians, anyone that is engaging in providing healthcare for people of determination, as well as non-medical. So receptionists, anybody who is patient-facing, orderlies, for example, those that may be taking appointments, anyone who is involved in the patient journey is invited to take part in the Unified Healthcare Training. And we see that there are 5 basic modules over the course of this training: an introduction to developmental and intellectual disability, the sciences and principles of behavior, of ABA, as well as strategies and applications of ABA, compassionate care provisions, and accommodations and modifications. Now, I'd like you to be able to see a short video that illustrates to you some of the techniques that we talk about and help healthcare providers to develop during the healthcare providers training. So we can see here that the appointment was made with an extended time block. Staff is actually engaging, they're assessing the needs, seeing that perhaps this patient is sensitive to the light, the use of visuals. We see a calming strategy, so bubbles, again using visuals, allowing patients to explore items so that they're not fearful. Human compassion, checking in with caregivers, making sure that they feel comfortable. Examples of visuals. And again, able to explore the items and getting consent. I apologize for that little technical error there. So that gives you a little bit of an idea of the types of techniques that we talk about during the training. We also want to give you an opportunity to hear from individuals, from Nipa herself, as well as other individuals who've taken part in the training. Now, as Nipa mentioned, one of the aims is to create this shift in culture across healthcare providers and institutions, so that diversity in all forms is accepted and that all stakeholders are educated and empowered. Now, through this change in culture, we can all together work to reduce the healthcare discrepancies that we see for people of determination. Now, you saw this in some of the previous sort of testimonials, that there was a variety. We had a speech language therapist, an HR professional, and a doctor. And all of their points of view were shifted based on learning more about how to engage effectively and compassionately with people of determination. So understanding the barriers and the concerns of POD and their families and building in the flexibility really helps to increase the support and create these shifts in culture. How exactly does this program work and who is trained? Again, both patient-facing medical and non-medical staff and members of the leadership we invite to take part in the training. This training runs for about 2 half days, not quite 2 full days. Generally on site in a healthcare facility. We also do offer the training in venues within the community, but we find that most healthcare providers prefer to host within their own facilities. This training is free of cost. There is no cost to the individual healthcare provider nor to the institution. And 9 continuing medical education units are provided for those participants who qualify. One of the ways that Special Olympics is hoping to motivate healthcare providers and healthcare institutions to commit to this change in culture, this shift in culture, is by creating an accreditation process, an accreditation system for all institutions that meet a certain criteria. And that criteria would represent that a critical mass of the leadership and the staff has successfully completed the training. I'll share with you a little more about how that's done. So in this table, we can see that there are various categories of medical institution. So for example, an individual to be accredited as a unified healthcare provider simply needs to individually complete the training requirements. And then each year, in order to maintain that designation as a unified healthcare provider, they will be asked to complete 1 Special Olympic UAE PD course or a Special Olympic UAE accredited PD course. And those courses will be rolled out over the next 6 months. Now, for entities that want to become a healthcare provider, because at the end of the day, this is what we want to see. We want to see entire clinics and entire hospitals changing the culture and the way they include people of determination. And in order to do that, we've worked out a matrix of what that critical mass is within each organization. So for example, an individual practice, a small practice, 25 staff members or less, would need to have a minimum of 4 staff complete the training. And those 4 staff, the designation would be, the breakdown would be rather, 2 medical staff, 1 non-medical staff, and 1 decision maker. Now, the reason we feel that decision makers are critical to this process is that as staff, both medical and non-medical staff, may ask to have shifts in protocol, ask for specific accommodations, we feel that this will be most effective if a member of the leadership has taken part in at least parts of the training so that they can understand the purpose behind and some of the methodology of the unified healthcare providers. Now, again, to maintain that certification over the future years, they would need to maintain staff certification, which means that if one of the 4 designated staff members were to retire or relocate, then we would ask that institution to train an additional staff member. Now, each of the 4 staff members that would be designated unified healthcare providers would need to complete 1 PD course a year, with the exception of the decision maker. So the leadership or decision maker would be exempted from this PD. Now, some of the benefits include obviously the 9 CME units for qualifying participants. All of the certified unified healthcare providers would receive certificates and pens that they could wear on their lanyard or their coats, and that we hope in time will be easily recognizable to the community as designating someone who has this additional training, this additional understanding of working with people of determination, that they will be seen as someone who is approachable and knowledgeable, and someone that is sought out, something that is sought out by families of people of determination. The entities would receive a plaque from Special Olympics that would designate their status as a unified healthcare provider, as well as being included on a healthcare providers list that we would maintain on our website, that would be published publicly, as well as social media coverage. So obviously, as the entities increase in size, the number of staff that they would need to train to meet that critical mass requirement will also go up. Now, the slides will be available to everyone. You can simply request these from us at Special Olympics. We have included references for those of you who are interested in diving in a little bit deeper into some of the topics that we've touched on today. And we also encourage anyone who's interested in learning more about the unified healthcare providers or any of the topics we discussed today, please reach out to us at health@specialolympics.ae. I thank you very much for joining us today, and we hope that many of you will join us and participate in the unified healthcare providers and join us in our mission to shift the culture of healthcare in the UAE to support the needs of people of determination. Thank you again, and enjoy the rest of the conference.